Public schools are going remote for all students starting tomorrow, and here to talk it through with us is Dr. Daniel Korytskas, Chief of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good evening, Emily.
All right, so in explaining this, Mayor Walsh said the city's 7-day positive rate is now at 5.7%. That's up from 4.5 last week. What exactly is the risk right now of keeping classrooms open in the city with that rate?
I think the big concern would be that either students could bring infection into the classroom and spread it among their classmates and potentially to the teachers and staff, or that teachers or staff might inadvertently bring COVID into the classroom and spread it to their students. And then, of course, from there, it can go back into the home to parents and grandparents and other potentially vulnerable individuals.
That could be so devastating. So that move comes as a leading health expert predicts the U.S. will see new cases rapidly accelerate in a week. Today, the daily positive rate here was above 5% for the first time in months. Do you think this trend will continue to increase, or is there a way to stop it?
I think there is a way to stop it. I certainly don't have a crystal ball, but I think as long as we continue to be careful about always wearing masks, right, limiting our gathering indoors in closed quarters without masks, and doing the kind of physical distancing and social distancing that we've been doing, we can hopefully bring those numbers back down and avoid the spike that we're seeing in much of the rest of the country.
Right. So Massachusetts is a little bit different in that regard. You know, we do know that some of these cases can be devastating, right? I mean, this is a deadly disease, but a lot of new cases will be mild. There'll be fever, cough, chills. You can just feel lousy. What is your best advice for treating COVID symptoms at home?
Treating COVID at home is a lot like treating a bad cold or a case of flu. What you need is some medication, whether it's Tylenol or Advil for the fever, aches and pains. Get lots of rest and drink plenty of fluids. If you have a cough or a congested nose, you can take some over-the-counter medications. And if you start having pains in your chest or feel short of breath and have a worsening cough, then you should really seek medical attention and go to the emergency department, or at least call your primary care provider.
Let's look to the future here, finally. You know, we know vaccines could be one way out of this. There are new concerns, though, about the ability to distribute one. In a letter this week to the White House, the National Governors Association mentions a shortage of dry ice. That caught our eye. Why is that important?
So one of the important issues in being able to distribute the vaccines is what we call the cold chain, keeping the vaccines cold enough that you preserve the structure of the vaccine until it's ready to be administered to a patient. And for some of those vaccines, they need to be kept at extremely cold temperatures, which is really unusual. And so we need either the freezers, or when the vaccine comes out of the freezer and goes into the clinic, the dry ice to be able to preserve the vaccine until it's ready to be given. And that's a big logistical challenge. There
are so many things to consider here with this. We appreciate you talking it through with us every single week. Really appreciate your time. Thank you.
Always happy to help. Good evening.
All right.